Good evening, and we would like to welcome you to our virtual speaker series on mental health. Tonight, you are in for a treat. We hope that you will sit back, think about any questions that you may have. We have a wonderful speaker, and you are bound to get great information tonight because your mental health matters. So at this time, I would like to turn the event over to our own SOAR, Dr. Bonnie Stanley.
Well, if I unmute myself, I apologize. Thank you. It's my pleasure to serve as moderator for tonight's discussion on reducing mental health stigma in the Black community. I would like to introduce Valerie Malky, who is the Assistant Commissioner for the New Jersey Division of Mental Health and Addiction Services in the Department of Human Services and serves as a single state agency for substance use and the State Mental Health Authority as designated by the United States Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. The Division of Mental Health and Addiction Services is responsible for the coordination, administration, management, and supervision of the community public mental health system, and is also responsible for regulating, monitoring, planning, and funding substance use prevention, treatment, and recovery support services. Ms. Milky holds a Bachelor of Arts degree from Fairfield University and a Master of Social Work degree from Rutgers University. Ms. Milky serves on the National Association of State Mental Health Program Directors, Board of Directors, and serves as president from 2019 to 2021. The National Association of State Mental Health Program Directors' goal is to advance national, state, and local mental health policy. Additionally, Ms. Melky serves on the Board of Directors for the National Association's Research Institute. The Research Institute provides invaluable data and information to the State Behavioral Health Agency commissioners and the public on various aspects of the public behavior health system. Ms. Melky also serves as first vice president on the National Association of State Alcohol and Drug Abuse Directors, Board of Directors, Public Policy Committee. The National Association of State Alcohol and Drug Abuse Directors' goal is to advance national, state, and local addiction policy. Ms. Melky serves on the advisory board of the Council of State Governments Justice Center, which is a nonprofit, nonpartisan organization that combines membership association representing state officials in all three branches of state government with policy and research expertise to develop strategies that increase public safety and strengthen communities. In addition, and led by the Council of State Governments Justice Center, Ms. Melky serves on the National Justice Count Steering Committee. This is a national consensus building initiative designed to improve the availability and utility of criminal justice metrics and data that can drive budget and policy decisions. Welcome, Ms. Milky. And because we have so much valuable information to get through this evening, I'm just going to dive into our questions. First, I'd like to ask you to provide an overview of your work and how it impacts those in New Jersey.
Yes, thank you, Dr. Stanley. And so for the Division of, as you said, I'm the Assistant Commissioner for the Division of Mental Health and Addiction Services, which is a part of the New Jersey's Department of Human Services. The Department of Human Services serves about 2.1 million New Jerseyans, or about 1 in every 5 state residents, and about 1 of every 3 children. And at the department, we serve individuals and families with low incomes, individuals with developmental disabilities, late onset of disabilities, people who are blind, visually impaired, deaf, hard of hearing, deaf and blind, parents needing childcare services, child support and or healthcare for their children, people who are dealing with substance use disorders and or mental health issues, and families facing catastrophic medical expenses for their children. At the Division of Mental Health and Addiction Services, we oversee a provision of broad range of community-based services, from prevention, early intervention, treatment, education, recovery services, including services that are for individuals who are at risk of having a substance use disorder and or a mental illness. We contract at our division with approximately 320 agencies for a wide range of mental health and addiction services. We also fund prevention services because it's important to prevent, to work towards preventing particularly substance use disorder as well as mental illnesses. And we serve at our division approximately 388,000 duplicated individuals per year. So what that means is that sometimes an individual may have a mental illness or a substance use disorder. That person would be counted twice in this count.
All right. Thank you. You certainly serve a vast array of individuals as well as providing a vast array of services for them. So as a policymaker, what are some of the key factors that are considered in meeting the needs of those that have mental health illness and substance use disorders?
Well, the first thing is that we need to keep on top of the evidence because it's always changing. And we want to assure that the services that we are funding and supporting demonstrate reflect the best and promising practices that are current, and so that it can yield the best outcomes for those that we serve. But what's also important for me is that we hear from our many stakeholders, particularly the individuals who need services and their families, because we want to assure, again, that the services are meeting their needs. And as they are identifying gaps in our needs and services, that we want to be able to meet those needs. We also take a look at the data that we collect that helps us to identify gaps, whether it be, certain ethnic populations or certain parts of the state that we identify are underserved, special populations related to, related to linguistic access, and different counties in the state. Again, because we want to increase access we want to make sure that there's access to our services to all New Jerseyans across the state. We also have a number of advisory committees, and on those committees, we also include individuals who have lived experience. And so some of the examples of some of the initiatives that we've rolled out based on some best practices, based on feedback that we've received from individuals who are seeking services and or their families, includes frustrations that we were hearing on the part of family members who were having loved ones who were going in and out of the emergency room. They were going into the emergency room because they were in psychiatric crisis, and then they were back out again without being connected to inpatient treatment because they were deemed they didn't need it. But then we're back and forth, sometimes multiple times a week, a month, but still their loved ones weren't getting the care and services that they needed. So we recently rolled out an initiative where we are connecting those individuals who are frequent users of the emergency room with people who have lived experience, people who have had a history of a mental illness, and we're connecting them with those individuals. Those individuals are helping to connect them to treatment. After they're discharged from the emergency room, they're providing them with support, they're connecting them to other social services. And what we found is that almost 90% of those individuals who have been frequent users of the emergency room have no longer had a visit to the ED. So that's something that, from hearing from the voices of individuals who reach out and speak to us, we're able to not only meet a need, but significantly make changes in some people's lives who had otherwise just been relying on an ED where they weren't really the right source for the services that they needed.
Right. I thank you for sharing that, because I think it's really important that our audience realizes that while we make policy, that you're also looking at the lived experience and that you're listening to your stakeholders as well as those who are receiving your services to provide the tools that they need to really access care and navigate the system.
Yeah, that's absolutely critical. Thank you.
So next, often you hear mental health, you hear behavioral health, conditions, illnesses, treatment. Kind of help us understand what is meant with those terms.
So one of the terms that you'll hear often is behavioral health services, and that typically refers to an individual who has a mental illness and or a substance use disorder. And so, and or at times even a gambling or a gambling use disorder. So so typically, in what you'll hear, throughout the Q&A today, when I refer to behavioral health, it's both individuals who have a mental illness and or a substance use disorder. And then, otherwise, if I'm just referring to mental health, it's specifically tied to mental health and mental illness and mental health services.
All right, thank you for explaining those differences for us. So next question, what mental or behavioral health services and substance use disorder services are provided in the programs that are under your oversight?
Yeah, so I'll just mention a few because we have a lot of services. We've been really fortunate in New Jersey in terms of funding to support our services. But first, to start, we have prevention services, including primary prevention. An example of that is, we have prevention programs that are working with student athletes that, like, when they experience an injury, to talk about alternatives to managing their pain to opioids, because we hear at times that young athletes begin to develop an addiction to the opioids, based on what's being, prescribed to them. We also have a prevention program that works with older adults who maintain pain medications in their medicine cabinets, and talk about how they can either alternatives to managing their pain, or how they can safely store their medication so that it doesn't get in the hands of someone who can abuse it. We also have many hotlines and warm lines. One includes 988. So I imagine many individuals on this call have seen 988 billboards and the like. 988 is a service for individuals who are experiencing a behavioral health crisis. So if someone is maybe feeling suicidal, or someone's concerned about a friend or loved one who may be experiencing suicidal thoughts, someone's experiencing a crisis related to their substance use disorder, they can call 988 24 hours a day, 7 days a week, and there's a trained counselor who will provide them with support telephonically that's needed. We also have other warm lines like Cop to Cop. So those are lines that are answered by individuals who are formerly employed in law enforcement, providing support services to individuals who are currently employed in law enforcement, again, to support them if they're experiencing a behavioral health crisis. We also have early intervention services. So we have one example is called Early Serious Mental Illness for individuals who are between the ages of 16 and 35. And that's a program where when someone begins to experience early symptoms of mental illness, this is a program that it's a team of individuals, including a psychiatrist, licensed clinical therapist, social workers, who will work with that individual to get them to the services that they need. Those services can include educational support. It certainly includes treatment for their mental illness and their symptoms, vocational services, and the like. And what the research finds is that the earlier the intervention, the likelihood that there's a greater likelihood that the mental illness would be less disruptive in that person's life. We also have, in terms of crisis intervention, early intervention support services. So that's like an urgent care program that's available in every county of the state. Individuals can walk in if they're experiencing a mental health crisis. And there's a prescriber that's a part of that team. There's a social worker, um, case managers, and they will provide interventions and services like an outpatient service program for about up to 30 days to help to stabilize what the crisis that the person may be experiencing. And then they will connect them to more traditional services in the community. So that's available in every county. We also have like pure respite beds. So if someone is experiencing a mental health crisis, but they don't need inpatient care, they can call one of our providers and access respite services. So they can stay in that home about a week, 2 weeks, and it's a very serene environment. And again, it's in like a private home, and they will receive supports there, and then they return back to their communities. Then we also fund treatment services. So we have a continuum of treatment services for substance use disorder, from from residential services to outpatient services. We also have fund detox services of mental health services, from residential services and housing to outpatient services, partial care programs. We have like a team of, it's called almost a hospital on wheels, where it's a team of individuals, including a psychiatrist, a nurse, social worker, um, a vocational specialist, and they go out to individuals' homes for those individuals who have historically not been able to connect to more traditional services and treatment. And then we have like mobile medication units. These units are in currently in 5 counties across our state. We are increasing our capacity there, and they're actually bringing medication to treat individuals who have an opioid use disorder. So on these vans, they're dispensing methadone and Suboxone, as well as they can provide counseling services. They have the ability to do urine drug screens all in this mobile van. And, and they go to the same spots every day so that individuals can continue with their services and treatment. And then we have what we call recovery support programs and case management. And in our recovery support programs, these are programs that are primarily delivered by individuals with lived experience to provide support to individuals who are in recovery or want to pursue recovery, whether it be for their mental illness or their substance use disorder. So we have some examples of that include like what individuals may have previously thought of as like drop-in centers. So we have those programs in every county for both substance use and mental illness, separate programs for each. And, it's a community of individuals with lived and life experience where they can talk about their experiences, talk about what's worked for them in their recovery, provide each other with encouragement, support, hope in recovery, and the like. We also have programs of supported employment, supported education, supportive housing, which is permanent housing for individuals who have a mental illness and or substance use disorder. And we have a specialty program as well called our PATH program, which is a outreach program for individuals who are experiencing homelessness who have a mental illness. And then we have awareness campaigns like 988, Reach NJ, and we have a naloxone distribution program, which I'll talk about a little bit later. And then the last thing is disaster response. So whenever there's a disaster here, like Superstorm Sandy, the opioid epidemic, that we have a team of individuals as well as other individuals who are trained in every county who can be dispatched, their emotional health as they're dealing with that crisis.
All right. So the services that you've just mentioned, are they available to, or do they have age limits?
So most
So
of
they're
our
available.
service, I'm sorry,
Mhm.
I need to. So,
They're
so
available.
most of our Yes, so most of our services are available for individuals who are 18 years of age and older. The Department of Children and Families serves individuals up to ages 26. The only exception is the early serious mental illness program that I identified earlier in our prevention programs. One of the things I did neglect to mention is that with all the programs that I've mentioned, that many of them are reimbursed by Medicaid, but if an individual does not have insurance, that these services that we fund are available without any out-of-pocket expenses, so that someone's resources should not be a barrier to accessing the services that they need.
All right, that's good to know. So kind of segue into that for our those services of mental health, behavioral health, and substance use disorder covered or included in a person's medical insurance.
Yes, so by federal law and state law, the federal law was passed in 2008, known as the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act. Some people may have heard the term MAPIA. That's what that refers to. And that requires health plans not to impose limits tied to behavioral health services that are over and above the limits they would require for medical surgical benefits. So for example, you can go see your primary care physician for a condition as frequently as you need to. Historically, prior to the passing of MAPIA, plans would say, you can have behavioral health services for up to 2 weeks in a year, right? This law makes that inequity against the law. In addition to that, though, the Affordable Care Act, which was passed, also required that mental health and substance use disorder services um, are to be covered as well. And this is for all insurance plans, with the exception of some of the grandfathered individual and small group plans. And then Governor Murphy himself passed the Mental Health Parity Legislation Act in 2000, the MAPIA, and again requires parity in terms of access to behavioral health services.
Well, we've had a lot of things and opportunities that have come into play to really help make access to treatment services available. And that's a good
Yeah.
All right, so now to kind of really shift this, and we kind of laid the groundwork to just shift into what our topic is for our program tonight. So I'd like to start off by just asking, in your experience, um, when you're discussing mental health treatment with those in our Black communities, what have you seen?
So first of all, just to provide a context, in 2021, the national statistics show that this is nationally, 12% of Black and African Americans reported having a mental illness, compared to 23.99% of non-Hispanic whites. However, just 39% of Black and African Americans receive mental health services, compared to their non-Hispanic whites, which was 52%. I'm sorry, I said 12%, but that's 21% of Black and African Americans reported having a mental illness. There wasn't as much of a disparity there. So my experience is that that individuals speak of the difficulty, first and foremost, of finding Black treatment providers, that they're looking for a therapist, a psychiatrist, a licensed clinician who they believe is really going to have the best understanding of who they are, appreciate their life's experiences, will be non-judgmental of their life's experiences. And so that's one of the barriers. Another barrier is that not only individuals have insurance or the money to pay for a therapist, and they may not realize that, particularly here in the state of New Jersey, there's a mechanism to access those services, even if you don't have insurance. Even if individuals are undocumented and don't have legal status here, they can access services through our programs. That individuals are concerned because of the stigma of mental illness or substance use disorders, that they don't want to be seen as weak, that they see that having these disorders are a sign of weakness, or having a mental illness is in a pejorative term, means that they're crazy, and they don't see it. Stigma gets in the way of individuals accessing services. Another thing that I've heard often is a general mistrust of government. And it's understandable based on, what we've seen in history, and even sometimes in the present, in terms of people not being treated right and fairly and equitably. So that at times inhibits individuals from seeking services. Sometimes people say, well, I don't have the time for this. I'm working, I've got my family, I have my responsibilities at home. I just don't have time to participate in therapy. And, or I don't have a way to get to therapy. And one of the things that through COVID that was made available is telehealth, so that individuals can now receive outpatient treatment, through the screen, like we're communicating now today, without leaving their homes. Another barrier is that people aren't aware that the services are available. This is why I just so deeply appreciate this opportunity to come to speak with you all today, because we don't want this to be a secret. We want individuals to know that these services are available, that they can be accessed without out-of-pocket expenses, and we want individuals to access them. And another thing is that, as I talked earlier about how we listen to our stakeholders and advocates, that unfortunately what I see, particularly in our Black and Brown communities, is that those aren't the faces that I'm seeing advocating for how we should spend our funding. And when we're not there, and when we're not at the table, and we're not talking about what we need, then the funders are not hearing that. And then they're not responding. And it's like this vicious cycle of, well, they're not serving us, that's not helping us, but we're not hearing your voices to know this is what the need is. So that's another really significant barrier to accessing services as well.
Thank you for raising that to our attention. Have you seen a difference in the perception of mental health illness, or between mental health illness and treatment between men and women?
So there are even differences in mental health and mental illnesses across cultures. There are intergenerational differences in terms of perceptions of mental health and mental illness, and race as well. And so one of the outcomes that we see in the differences in perception between for men and women is that we see that that men tend to seek treatment less than women. And the outcome of that is that in 2021, the Centers for Disease Control and Prevention, the CDC, identified that nationally, deaths by suicide, although they decreased in the US by 3%, but among men of color, including Black men, they were increasing during that same time period. And so when individuals aren't accessing services and treatment, the outcome is very significant. So.
You touched on this previously, but how would you describe the hesitancy that to access of care in the Black community?
I think in part it's driven by just not knowing that there are certain symptoms are tied to early behavioral health symptoms. Providing a personal example, I remember in college, a good friend of mine who probably one of the smartest people I knew, and like by our third year, he just started acting a little different and started thinking that, his circle of friends that he had known for the duration in school was out to get him and were saying bad things about him. What we learned later on was that those were early signs of a mental illness. So at times we just don't know and understand those early symptoms to get people the treatment early on. Again, as I mentioned, the lack of trust of government, it's grounded in real life experiences, and it's tied to the base, to bias, to racism, to discrimination, to inequitable treatment that the Black community has experienced, here in the United States. And again, as I mentioned, that people see seeking services and treatment, particularly for a mental illness, as a sign of weakness, or in seeking treatment for an addiction as a moral failing. And what comes with that is then feelings of shame, and then those feelings of shame, um, end up result in people not going out and seeking the services that to treat the illness that they are suffering from.
Yeah, yeah. Well, as we all know, March is Women's History Month. So as we celebrate Women's History Month, is there a special information or message that you'd like to share with us tonight?
Yes, thank you. That's especially why I'm so happy to be here today and at this time. So, we're mothers and daughters, sisters and wives, and our households. We are caregivers, friends, neighborhood leaders, and on and on. And so we hold the balance of many of these roles really at the same time. And so it's important to know that mental health includes our psychological and social well-being. It affects how we think, how we feel, and how we act. And it helps to determine how we handle stress, how we relate to others, and how we make choices. So again, it affects how we think, feel, and act, and determines how we handle stress and relate to others and make choices. And so the healthier that we are, even as it relates to our mental health, it really it influences our day-to-day lives. It influences how our relationships with our friends and with our families and with our employers. It influences the choices that we make, how we feel and think about things, how we perceive things. Mental illnesses range from mild to severe, and impact people differently. But what's important to know is that 1 in every 5 individuals in the United States live with a mental illness. And that mental illness doesn't discriminate. It affects anyone irrespective of their socioeconomic status, their ethnicity, their race, their income, their religion, their sexual or cultural identity, their age, where they live. And so that there's no shame in seeking treatment or support when individuals are faced with a behavioral health issue. So the message here is that it's important for all of us to be attentive to our mental health and our wellness needs. And being attentive that when something doesn't feel quite right, that we should seek the supports and the treatment when necessary. Again, it's an illness. Someone thinks they have strep throat, they go to the doctor, they get medication, it's resolved, they move on, right? Mental illness, same thing. Like I said, it ranges from mild to severe, but it's important that when you feel that things just aren't right, you should go and seek services.
Mhm.
And this in essence helps to build your own innate resilience and your own wellness. And it helps you live a healthier life.
Yes, thank you. Thank you so much for that message. And I think in our community, we also have to be open to recognizing it not only in ourselves, but in those that are in our community. And, just helping them to understand exactly what you said, that it is an illness and it can be treated. It doesn't make you any less of, we need to just try to work to remove the stigma, the perception that individuals have of the illness, and to just seek treatment, understanding that whole health is our goal.
That's exactly right. That's
Yeah.
exactly right.
So I understand that you have some resources that you would like to share. And then from there, we can start opening it up to answer questions that we have from our participants.
Okay, great. Thank you so much, Dr. Stanley.
Thank you.
So yeah, so if we can, so first of all, on this slide here, and I just wanted to share with you that the 609 number is our main 438-4352 is our main number to the Division of Mental Health and Addiction Services. If you or someone you know has questions, is looking for access to services, any of the ones that I mentioned or anything else, please call that number if you don't know the specific telephone number for the resource that you're looking for, and we will help to get you there. We'll just ask a couple of questions to see what would be of most benefit to you, and we will connect you to the right service. This information on this slide, so 988, I referred to that earlier. That's a confidential and anonymous nationwide hotline for suicide prevention and mental health and substance use crisis. So if someone's experiencing a crisis, they should call, they can text, they can chat 988. We are currently expanding our capacity to answer text and chat here in New Jersey, and call as well. But so when you call 988 now, what will happen is it goes to a central national location and then gets sent out to the states based on the area code of the phone number. And so anyone who's calling from a New Jersey line, in most instances, it's going to be answered by someone who is trained and here in New Jersey. If for some reason the lines are full in New Jersey and it's not picked up, then it bounces to a centralized national vendor who will answer the call. And if someone needs to get connected to New Jersey services, they know how to connect them to New Jersey services. The time they are answered by someone here in New Jersey. Second floor, the next slide, second floor, this is for, it's again, a confidential and an anonymous helpline for youth and young adults between the ages of 10 and 24. This is a program that is funded by our colleagues over at the Department of Children and Families. Again, this is both 988 and second floor. They operate 24 hours a day, every day of the year, including holidays. And then Reach NJ, 1844 Reach NJ. This again is a confidential and anonymous hotline where individuals who have a substance use disorder can get immediate assistance and support by live trained counselors. So more specifically, our contract is with Rutgers, and they answer these calls 24 hours a day, 7 days a week, connect people to addiction treatment, as long as they're willing to participate. And again, with this, as they connect individuals to treatment, if they don't have insurance, we have state dollars to support the cost for the individuals to access treatment. So cost absolutely should not be a barrier for people to seek addiction treatment or mental health treatment for that matter. So, and then the next slide, please. So these are just links to different directories. So when you go to the mental health directory here, you'll see a directory of providers who are under contract with us. It's not it's not for all of the services, but it's for the main services. So it includes the early intervention support services, or like that behavioral health urgent care type model. You can find out who the provider is in your county going to this directory. We have in there our crisis screening services in this directory. Outpatient programs are listed in this directory, and many others. And then it provides the telephone number, the contact information, and the addresses for those providers. We also have our addiction treatment provider directory. And in that directory, and this is not just providers that are under contract with us, but these are providers who are licensed in the state of New Jersey treatment for substance use disorder. And when you go to that link, you can search by the type of service you believe you need, as well as the county and the like, and it'll come up with the providers. I still think that the easiest and best way is to call Reach NJ, because they will do all that and definitely connect you to those to the services that, based on what the individual is presenting, the service that they think that best meets their needs. But this addiction directory, individuals can go there and then contact providers directly if that's what they choose to do. And then the last thing here is information about free naloxone and our pharmacy participation. So naloxone is the antidote to an opioid overdose. So if someone overdoses on an opioid, whether it be they were prescribed a pain medication, Vicodin, let's say, and they the pain is so bad they take the medication over and above what's prescribed, they overdose. This naloxone can literally saves people's lives. And then, once that person is revived using this naloxone, it's an intranasal spray. Then individuals should be taken to the emergency room to be checked out. And so we have pharmacies across the state who are making this medication available for free. Every New Jerseyan should have free naloxone, should have free naloxone on them. To go to a pharmacy, they're not going to ask you, or they should not ask you if you have insurance. They should not ask you for your name. They should not ask you why you need the medication. All you have to do is walk up to the counter for those pharmacies that are participating, and that link will take you to the pharmacies that are participating. We have pharmacies participating in every county. You just walk up to the pharmacist and you say, may I please have my free naloxone? The only time they should ask a question is if an individual looks like they may be around the age of 14, then they'll ask them if the person is 14. The person only needs to confirm that they're over the age of 14. They don't need to show any kind of identification or anything like that, and they can get free naloxone. We should have naloxone in our houses. We should have naloxone in our pocketbooks, in our briefcases, because you never know when someone might experience an overdose. And it really is as easy as spraying this medication in someone's nasal cavity to save their lives. So that ends that. And then what I wanted, a number of ads that are out there and available, commercials regarding the free naloxone giveaway, 988, and how to access substance use treatment through Reach NJ. And I just wanted to share with you one of our voiceovers that that we just recently developed and is beginning to appear. And the reason why I wanted to share it, because it really captures, although it's speaking about substance use disorder and access to services and how you access services, more broadly, when you think about behavioral health and the shame and the reluctance for individuals to, for individuals to access services, this ad kind of captures that. It's in the spirit of this ad, it kind of captures that as well. So I thought this would be a great way to end the question and answers before, this dialogue before I go to Q&A.
Sick. Anyone can struggle with addiction. And when you're struggling, there's no shame in getting help. I'm over the shame. I know who I am, and I'm in recovery for me.
Call 844-REACH-NJ. Talk to a counselor for confidential addiction help and see if you're eligible for no-cost treatment. 844-REACH-NJ from the New Jersey Department of Human Services.
Thank you. So I did see that there are some questions in the chat. I gotta tell you, so first of all, before we go here, so like I said, about a month ago, we developed that ad. It gives me chills each and every time it's read, because what I will share with you is one of the things that we're experiencing here in New Jersey is that although the individuals who are dying by overdose deaths are going down, and they have been going down the last 3 years, they are increasing in our Black community. Deaths by overdose are increasing in our Black community. And we've got to find a way to get the message out there that treatment is available, that you don't have to worry about having to pay for them, and you don't have to suffer. It's affecting families, it's affecting individuals. And so I always get emotional when I hear that ad, because it just reminds me of the work that's ahead of us and the work that we need to do to make sure our communities are aware that this service and this resources are available.
Yes. Well, we certainly thank you for all of the good information that you've shared with us today. And we can go to the Q&A. Do you want us to do it straight from the chat, or Bianca, do you want to help moderate?
Did you want me to read that? I have the chat, the meeting chat here in front of me. I don't know if questions came in another route as well.
Bianca will take those, so you can just answer, okay?
Okay.
All right, good evening, Ms. Melky. We have several questions that were here in the chat. I'm going to start with the first question of, how do you serve the homeless population?
So we have a number of initiatives. One is that we have contracts with a provider in every county of the state to go out and do outreach. So they're not only just going to the shelters, they're going to places where individuals who are completely unhoused are, to get them connected to services, to provide case management, to get them connected to treatment, as well as getting them to work to get them connected to housing. We also have initiatives like for addictions. We have prescribers who are actually going into some of the shelters to prescribe medications for their opioid use disorder, and to help to get individuals access to services and treatment. We also make some of our supportive housing initiatives, which are where we have housing subsidies as well as mental health services that connect with that, available for individuals who are homeless, who have a mental illness. And so, although those subsidies are, we're limited in terms of what we have. Again, if individuals were to call that main number that was on that slide deck and ask to get connected to our housing unit, they can work with individuals to see if they're eligible, and if there's a housing subsidy that's available that can be used. And many of our other services as well, certainly they serve individuals who are homeless, but those are some of the affirmative outreaches that we have to identify individuals who are homeless, to get them connected to services.
All right, thank you. The next question we have from Tamika S. Says, I'd like additional information on the PATH program. Is there a site?
Yes, there is. So if someone wants to identify the PATH programs in New Jersey, I believe it's on that link that I provided on our mental health directory. And I can also, is it easier if well, you know what, while you're asking me the next question, I can see if I can identify the national site regarding the.
All right. And additionally, we can also send that information out to those who have registered this evening, so that they have that information at hand.
Okay, so why don't we do that? Okay, thank you.
Okay. All right. The next question we have from Linda. Does your department have a resource booklet or information available on the website? Please share the link. I think we just kind of answered that question.
Yeah, so we also have, so the border department that I spoke of early on, we also have a much more comprehensive directory. So I will send the Department of Human Services directory, because then it will identify, many more resources than just the mental health and addiction resources on the link that I provided to you.
Okay, and I'm actually going to piggyback off of that question. Does the DVRS division also work with you all closely to provide services for those individuals who were identified as having special needs and may need additional mental health services?
So yeah, so we work closely with the Division of Disability Services, DDD, because a number of individuals have coexisting mental illnesses, and so we actually have some joint initiatives where we, that we fund to support individuals who have those dual diagnoses, and certainly the Division of Disability Services, DDS, we will certainly work with them. Sometimes we even, some of the individuals that we serve, will refer them to DDS for support, for additional supports. And all of the other, divisions like deaf and hard of hearing and blind and visually impaired. I mean, we work closely when we have individuals who have coexisting needs. So yeah, we absolutely do.
All right. One of the next questions that we have are there multi-language services available?
Yes, so we require our agencies for their services to be accessible. Although we do have some providers that that specifically are contracted to serve individuals who for example, speak Spanish. Many of our providers, because New Jersey is such a diverse state, with many different languages spoken here, that what in some instances, what our providers will do is use like an online, like a language line or something like that to try to bridge the gap. And individuals who are providing services who speak that the language of the individual who is who's presented for services. So
All right. I'm going to do 2 more questions from the chat, and if it's okay with you, if we take the remaining questions and send them to you to be answered, and then share them with those participants here tonight. Does that work?
absolutely.
All right. So let's go with a question from Sherry, who asked, how is loneliness affecting mental health, and how can you reach these individuals?
Loneliness has had, particularly like with COVID and individuals being alone, has a significant impact in terms of someone's mental health. And so, we hope that with some of the ads that we've had running, whether it be particularly regarding 988. Early on in COVID, we had some COVID-related ads as well, that individuals are seeing them online. They're seeing them, they're seeing them virtually, so that, and then it prompts them to reach out for services. Otherwise, it's difficult to connect with individuals if they're alone and not involved and engaged in services, for us to know, what the challenges are. But we're hoping that through some of our ad campaigns that individuals will reach out to us. And we do see, honestly, we have seen, like with our 988 ads,
Mhm.
our calls volume has gone up from like 4,300 calls a month to like 6,500 calls a month. So some of those things, I think, some of those strategies, I think, may be working.
All right, and we'll do one last question. Do you think social media plays a part in the increase of mental illness amongst children, and how would you suggest that this is addressed?
Yeah, I absolutely do. There are a lot of unhealthy things that are out there in the media. And so I think that it's, giving parents strategies around how to limit what their youth or what their children are listening to and exposed to, providing them, and not just limiting what they're exposed to, but looking for alternatives to fill the gap, for children, and with activities and the like. And there, I believe, I know that there's like social emotional Department of Education. I know that our Department of Children and Families, has some services and resources as well that may be helpful for families who are, in terms of how to manage that. But yeah, it's what's out there is not always good and healthy, and spending a lot of time is not good and healthy as well.
All right, so that's actually going to wrap up the Q&A session. Again, I'm going to take the questions from within the chat and send them to Ms. Melkis for her to answer, and we will email them out along with the resources that she listed here this evening to be shared with everyone, because this was a great wealth of information that we all need, that can be used in our everyday lives and or passed on to our network. So I do appreciate you in providing this wealth of information, because we need it, especially in the height of after the pandemic. So I do appreciate you for sharing such great information this evening. As we wrap up the Q&A, I also want to invite you all to complete our evaluation survey for this program before you all leave. Just to help us gauge on how we did this evening. And you can also put additional questions in the survey. If you have additional questions that can be answered and emailed to the masses. So the link has been shared. I'm going to share it a couple of more times because people are giving you praises in the chat. So as the praises keep coming on in, I'm going to keep popping the survey in as well. Sarah Stanley, would you like to come in at this time while we're taking moments for the survey?
Yes. I cannot begin to summarize all the wonderful information that you shared with us. And I really think that and hope that it has been as beneficial for others as it has been for me. I think that it's really important for us to understand that we are our brother and sister's keeper, so that we have to also take care of ourselves first, and then we also have to look out for those around us and notice when things are different, notice when reactions are overreactions, and really play a role in helping our community to heal, to understand that there is no stigma, and that it is an illness, and that it is treatable, and that treatment is out there for you, whether you have insurance or you don't have insurance, and that it's important for us to do that for ourselves and for each other.
Thank you so much. What an honor and a pleasure it's been to be here with you this last hour. And I really want to thank you, Dr. Data, for raising this issue, this very important issue today and this evening, giving me an opportunity to speak to it. I really appreciate you all and for being here today.
Thank you. And now a word from our chapter president.
Well, this was definitely an on topic, on time presentation. First of all, thank you so much, Assistant Commissioner Milkey, for sharing your time, your knowledge, and most importantly, your resources. We say all the time that so many resources are out there for our community that we just don't know or have access to. So thank you for bringing your knowledge, your resource. Thank you for being who you are in the space that you take. At least we know there's at least one voice at the table, but we're going to get you some more stakeholders at that table so our needs and our concerns can be addressed, and definitely, those resources to our community that we serve. So once again, thank you for your time. Physical mental health, I'm just so proud of you understanding the importance of this topic, but doing it with excellence, and with our community in mind. Thank you. Kudos to you to Soar Stanley for just being who you are in this space. So thank you so much to the committee. Thank you. We are definitely going to use your resources, and we consider you a partner now. Okay, so we're going to be calling on you. Because I see big things ahead, particularly as we leverage who we are in Mercer County with your resources to make sure that our community gets the resources, particularly with mental health and substance abuse. Because if we're not part of the solution, then who will be? So we thank you so much, and we appreciate you so much. And now you're a partner, so we're going to be calling on you. And thank you so much for all you do.
Thank you. I look forward to it. I sincerely do. Thank you.
So at this time, we would like to thank everyone who has joined us tonight. We hope that you enjoyed it and got a lot of information. So we thank you and have a wonderful evening.
Thank you.
Thank
Thank
you.
you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.